Hi everyone, this is Dr. Mehmet Erdogan by Smile Hair Clinic. I'm one of the hair transplantation surgeons and I would like to share with one of my patient experience as case study today with you in that video. So today's patient is 26 years old. He had his surgery in 2024 February and as today we have his 9-month result, and I would like to explain every step that we take and the progress about the patients in this term. So let's start with his file first. He doesn't have any other disease. He has just a SMP done 3 years ago. It's still visible with the hairline. His main request is to reconstruct the frontal part and try to cover as much as from the front till the crown area. Now let's check what we have in the clinic. By the way, I forgot to mention he has 3 years of minoxidil usage in 2022, and for a long time he has not been using the minoxidil anymore. Let's check with the photos that is taken just before the preparation in our clinic, but before the operation. In these photos you can see that his both temporal part is receded, his frontal part is almost missing, there is not too much hair growth. It's called miniaturization process. Sometimes the hairs will just falls off and sometimes the hairs just become thinner and miniaturized. In his condition, I think he has pretty much from the hairline till the back part. If I'd like to comment on his SMP or other patients with the SMP request before the operation or after the operation, I think if the patient should evaluate and also the doctor will give his recommendation depending on the case. But for this patient, for example, my theory and my suggestion will be, if he were asking me before, not to do the SMP, because we can cover these kind of patients without any problem. So you don't need to do the SMP. After that, if you are not happy, if you want to have a quick solution, if you do not want to go to another surgery at that time, yes, SMP is a very quick process. You just do it in 1 day or half day and you immediately get the result. You don't have any recovery periods. Hair transplantation is a bit more complicated than that. I'm sure that you know, and we also know that thing too. With the SMP, it's important patients should not decide very low hairline. Also, it's including for the hair transplantation too, because if you have a lower point, it's very hard to get filling the other parts. Yes, this is from the front. His crown area is also thin and miniaturized, his mid scalp as well. And now let's check the photos during our consultation. The patient also, we created his hairline, we did the planning, so let's check that photo right now. Okay, so temporal parts are need to be restored, the frontal part almost not too much hair, mid scalp and crown. We planned for everything. I mean, we planned like we are doing everything. I think that's the best way to do it, because we may have more hairs than normal. Okay, let's check his crown. Crown area and the other areas are, as you see, the donor quality is very important. The size is important. The density is important, the thickness is important, and also another thing is if it's single or multiple ratio. So these are giving us the quality index of the hair, which is also giving us the result as well. It looks very good, by the way. I mean, we once we see the patient in the morning, we are sure about the results mostly. If there is not too much surprises, we are seeing the same thing. So let's check his photos just after the operation, I mean just 13 days later. I would like to show you that because patients are also very curious how they appear at that day, because they are just curious about if they can go out or not. So the front looking perfect. I mean it looks very good. He can just go out with the frontal part. Maybe some small scabs still. I think he should wash much better, because after the 10th day we allow them to remove those scabs. There are still some scratches which could be due to the density and also the skin dryness, and I think more important is the donor area. Look in the 13-day photo, yes, with the crown area and with the donor area there is a slight difference, the contrast difference. It's because the hairs are more longer than the other areas, because we shave the donor area. Otherwise, if you just make it even with a trimmer, it looks like that there is no transplantation extraction. which cannot be seen. Also, there is no effect of the 4750 grafts. So it's a very good example of high numbers doesn't do anything if it's done properly. Let's check right now the 6 month. Wow, it's good. It's very good. It's growth already. It has more texture, more hair thickness happened, and he's a different man already. He changed too much. It is from the side view. It's from the top view, almost like you've seen the front temporals, mid scalp, and everything seems covered right now. Donor seems a little bit darker, but still good. Okay, 6 months. He got already the result. That's a very good thing, I think. He sent some photos from 9th month, I think. Okay, so in the 9th, just some crown area left, still some low density, which is very expected because we are able to do more front. We just did some crown, so we were expecting some. So it's just, but it's a very small area, I think. The front is looking very well, very dense, very good looking. The mid scalp is covered, the both temple parts are covered, so I think it's a very good result, and I'm also pleased to see the patient results, and I'm happy and he's also happy. So I think I tried to explain to you everything that we did with this patient. Thank you for watching. If you still have some questions to us, please write at the comments below. We will be answering them. Thank you.